Last May, we told you how families were waiting up to 6 months to get autopsy results after a loved one died of a drug overdose. The medical examiner's office was overwhelmed with cases.
A year later, the Erie County Health Department tells us there's still a long wait. News 4's CALLAN has been following this story. She spoke to local and state leaders about what's being done to get the families the answers they desperately seek. CALLAN?
Well, Don, Jackie, families tell me the wait is emotionally taxing, that they need to know how their loved one died, and hopefully that information can be used to save someone else's life. In Erie County, it's supposed to take 60 to 90 days to get autopsy results to a family, but the health department tells us it is still taking much longer than that. We sat down with stakeholders to find out what's being done to help families find closure. There are 138 families in mourning in Western New York. 24 of those families know their loved one died of an opioid overdose this year. For the 114 others who lost someone this year, an overdose is suspected.
It's hard to imagine that you would never attend your kid's wedding, graduation. There'll never be a girlfriend. There'll never be dinners. They never get old.
Avi Israel's 20-year-old son Michael took his own life in 2011 after battling an addiction that started when he was prescribed narcotic painkillers for Crohn's disease. Israel now hosts a grief group for other parents. That's where we met half a dozen parents 1 year ago who described the feeling of waiting 4 to 6 months to get their child's autopsy results.
Like someone's sitting on your chest. You just want to know. You know what I mean?
You cannot move forward with numerous things, whether it's insurance or how to take care of other obligations that your child may have had, until you have a reason for death, and that's the autopsy.
The Erie County Health Department told us then the medical examiner's office was overwhelmed because there were so many overdose deaths, and the toxicology lab had more tests to develop and validate. Now, 12 months later,
Families are still waiting. We've had families that come in here who have lost kids in January, March, and early April. We have families that have been here since last year, of late last year, and still waiting for the medical examiner report.
Erie County Health Commissioner Dr. GALE BURSTEIN says the medical examiner's office has about 1 new suspected overdose case every day.
It's really a lot of work. It's very busy.
The county has taken steps to upgrade its equipment since our story aired last year. They've gotten new, more sensitive and efficient testing tools, new software to streamline data, and they're renovating the medical examiner's office. Plus, the county announced it secured a $10,000 grant from the U.S. Department of Justice for the medical examiner's office. Still, Dr. Burstein says more help is needed.
We would really need help everywhere. You know, the medical examiner, more toxicologists, more people to investigate cases. Everybody in the medical examiner's office now is really doing the job of 2 people.
Burstein says since 2011, the caseload for medical examiners has increased 61%. But in 2011, she says there were budget cuts.
Chris Collins made some pretty severe budget cuts to the medical examiner's office, which resulted in a 40% decrease of staffing.
Burstein says some of those positions have been restored by County Executive Mark Poloncarz's administration, but not all.
The financial situation in the county, it's hard to get a large number of new positions approved by the legislature.
The spokesperson for the legislature's Majority Caucus says this year the legislature passed the budget for the medical examiner's office exactly as it was handed to them by County Executive Poloncarz. It included a nearly $111,000 increase in funding. Burstein says the burden doesn't just fall on the county.
The state had discontinued its funding source to the medical examiner's office.
According to BURSTEIN, that happened in 2012, and if that money was still available, the medical examiner's office would have received $1.2 million this year.
The state can step up and find a way legislatively to help to expedite the process, make the process more efficient and effective. We will absolutely do that.
If we didn't have this information from the medical examiner's office, we really wouldn't have a handle on the number of people who are dying of this opioid outbreak. We wouldn't have a handle on the prevalence of fentanyl that are causing about 75% of the opioid overdose deaths in our community.
While the county uses this information to prevent more people from dying from opioid overdoses, family members who have already lost a loved one are looking for peace.
For Julie and I, when we got the letter, we actually went outside the house and sat on the front steps and read it together, and it shakes you up. It shakes you up, but it also brings you into reality that your kid is gone. A lot of people need to have that sense of closure.
Now, right now, I'm told there are no bills up in Albany to help ease the burden on medical examiners, but I did reach out to 9 state lawmakers who represent Erie County to find out if they would support renewing the funding the state cut back in 2012. I heard back from 5 lawmakers. They all say yes, they support giving the medical examiner's office that additional money. Reporting live, CALLAN, News 4.